And here with more plus answers to your medical questions is our Ask the Doc specialist, Dr. Msonthi Levine. Do you like how you're now a specialist?
Thank you. Yeah, I appreciate it. I work hard.
So as far as the new guidelines on cholesterol lowering drugs?
I think right now it's controversial, and I think physicians like myself in the trenches, as I say, will probably stick to what we know right now until they can figure it out, and we'll know at that time when the physicians who study this more in depth than we do can tell us what the guidelines are. So for me, I'm just going to wait and sit and wait for those guidelines to come out. For now, I'm going to continue to use the guidelines that I've used for several years, and basically it's just an assessment of cardiovascular risk, and most physicians are familiar with that. Smokers, diabetes, those sorts of factors, high blood pressure, family history, those have been around for years and they're never going to go away. And I think most physicians have a good comfort level using those. So I think they work really well in terms of what we do now. But there's always a wrinkle with medical science. But I think it's controversial right now, so I'm just going to stick with what I know.
All right, on to some of our viewers' medical questions. This viewer says, I have tinkling pins and needle sensation in the bottom of my feet every time they hit the floor, whether it be when I get out of bed in the mornings or standing up from sitting on the couch. Any idea what it could be? Probably
some degenerative joint disease in her feet, probably pinching nerves in her feet. Sounds like a musculoskeletal problem as well, so I'd probably get some x-rays. See a podiatrist, maybe even place her on some medications such as Lyrica or Neurontin, or some shoe inserts, which probably the podiatrist would recommend.
Okay, another question. I've been having some severe headaches. My doctor sent me for an MRI, but I couldn't afford the $1,000 deductible.
Ouch.
What other choice do I have to figure out what's going on?
You can probably start with a CAT scan, which is still a very powerful x-ray, but tends to be a lot cheaper. Some of the freestanding radiological suites here sometimes will offer cash payment. They'll have a discounted price. Those are some things that they can do.
Okay, another question. My fingers are starting to bend at the top. Is that a sign of arthritis?
Possibly so. X-rays can help us evaluate that. Certainly depending on your profession, you might have a little bit more trauma to your fingertips or your joints, overuse or misuse, as sometimes that can happen. So X-rays a lot of times will figure that out for us.
Is there a special treatment for rosacea?
There is. There's a topical medication called Metrogel. There's an antibiotic called doxycycline. You can take it twice a day. There's also a once-a-day version of that, name brand, but typically can be treated successfully if you can take the medications and be compliant.
Those are all prescription?
Those are all prescription.
Okay.
I don't know of anything over the counter yet.
Okay. Another question, what's the best home remedy for a toothache until you can get to a dentist?
Probably something along the lines of Tylenol or anti-inflammatory medicine such as Motrin or Advil. Ice works really well, but certainly if it is a bad infection, it's going to need some antibiotics and probably need to be pulled. You may try some other herbs, over-the-counter nutraceuticals, as we say, that might help with pain as well.
Do you try to pull it yourself?
No.
That will just cause more pain?
Yes, absolutely. You don't want to mess that up because the tooth could crack and break and then it stays in the gum line. So I just wouldn't mess with it. I mean, you're talking about your mouth in terms of being able to eat, talk, communicate. Those are very important issues, and you want to be sure it's in professional hands.
And it's pretty close to your brain.
Absolutely.
Okay. I have a toenail that grows wrong and turns colors. It also gets harder every time I cut it. Any idea what she can do about it?
Probably wear some good shoes. If this is a female, a lot of times the shoes can cause a lot of pressure on the toenail and disrupt circulation, cause microtrauma, and that can discolor the nail. Be aware of fungal infections as well as bacterial infections. Those are very common in our society. Sometimes rheumatological illnesses such as lupus, rheumatoid arthritis, psoriasis can cause problems with the nails, so I would get that checked out as well.
All right. We've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This woman called. She's got a 7-year-old with asthma. He was put on Singulair at the beginning of the school year. He was excellent in school. Now he's fidgeting. He is angry. The old doctor wanted him to be checked for ADHD and ADD. Do you think the Singulair is what's causing the fidgeting and the angriness?
Yeah, I mean, medicines can do a lot of funny things. I always say, if you think that's the case, just go ahead and discontinue the medication for 2 or 3 weeks. That'll give you an answer right there. A lot of times we don't have blood work or x-rays that tell us that. Just stop the medication and see what happens. I think that would be an easy fix. Never assume that it's not the medication. These are chemicals. Everyone responds differently. You've seen the whole list of things that can happen to you when you go to the pharmacist and get 4 or 5 pages of potential side effects. So if anything can go, then just stop the medication.
What do you do about the asthma?
A lot of times there are inhalers that you can try, antihistamines that you can try. So Singulair is one piece of the puzzle in terms of treating asthma. Certainly look at your environment. Make sure your environment is asthma friendly, because a lot of times the environment is the reason why a lot of people have exacerbations. But that's more difficult to change other than just pop a pill. So that's one thing to think about.
Living in Southeast Texas, we have a lot of asthma
induced
conditions.
The refineries, certainly a lot of the woods, the trees, the pollen when it's the pollen time, but a lot of times the houses with old furniture, carpets, pets, insects. These are a lot of the reasons why a lot of people have exacerbations of asthma.
Okay. Another question, a man with neurofibrosis, what can be done about it?
You know, I don't see this disease that often. Seemingly from the description, it's scar tissue of the brain, typically not a whole lot. You know, for a lot of illnesses, we don't have a lot to offer. Research is not there. The money is not there to get those medicines, those procedures out there. A lot for heart disease, obviously, and breast cancer. But for certain illnesses like this, not a whole lot to offer. The diagnosis can be made, but still no effective treatment.
Okay, a man diagnosed with early Alzheimer's. Can anything be done to slow its progression?
I think the big thing is recognizing that someone may have that. So if anyone out there thinks their loved one or themselves has it, get to your physician, because the medications are effective. The earlier you start the medication, the better they work. I think a lot of people wait a long period of time, wait for it to progress, get more of a moderate stage, and then the medicines still work, but not as well as if they started at the beginning of that stage.
And there's a big lunch going on tomorrow. The Alzheimer's Association is putting it on. There are support groups that can help, and you can find out a whole lot more. 11:30 out at the Country Club. Just wanted to mention that.
Very good.
If you've already had shingles, should you get the shingle shot?
You can, but you can wait about a year or so if you just had an outbreak. There's been a lot of discussion about that, so we still recommend shingles vaccine for those who've had outbreaks already.
Okay. A woman had a C-section 6 weeks ago. She started bleeding recently. What could cause that?
Anytime you've had a surgery and it's been about 4 to 6 weeks, it could be something related to the operation, may not be, but I always recommend patients get back with the surgeon, just get a brief evaluation, make sure it's not related to the surgery. But there are other things that can cause bleeding in that area, bladder infections, lacerations to the vaginal area. So certainly that is not normal to be bleeding, so get back to your doctor.
Okay. Sinus infection since January. This person has had antibiotics several times. What else could be done?
I probably would get an x-ray of the sinuses to make sure there's not polyps or deviation of the septum, or just to see anatomically maybe there's why they're having repeat infections. Get to an ear, nose, and throat doctor. They have surgical procedures that can alleviate these anatomical defects if they are found. Again, pay attention to the environment, because a lot of times that is a cause of the frequent exacerbations. Allergies can cause sinus inflammation and continue to have the infection. So a lot of different things to check out.
All right. As always, doctor, we appreciate you stopping by
Yes,
and answering all of our questions. And you can always send your medical questions every Monday on Ask the Doc. You can mail those questions to the address listed on your screen. Email them to us at laf@kftm.com, or you can post them on our KFDM News Facebook page every Monday.